Okay, hello and welcome to the week 2 content. This week there are 2 videos that will cover what we need to know about anatomy. So you'll be taking more courses throughout your 4-year undergrad that are focused solely on anatomy, but we need to cover some of that content now before we get into talking biomechanics. So on that note, I do want to apologize in advance for how dry these videos will be. There are a lot of definitions to cover and it's not overly exciting. So please just bear with me, pause the video when you get bored, take notes on the side, whatever you need to do to get through these videos and make sure that you understand the definitions that we're going to cover here. So by the end of this first lecture video, we will learn about the different forms of motion, what the anatomical position is, what that means, and then the different planes and axes of motion. So first of all, anatomical terms of motion are terms that describe movement. So it's important for you to understand that these anatomical terms define 2 segments or 2 limbs that are moving on either side of a joint, which is defined as relative angular motion, rather than just describing an individual limb movement, which we can think of more as a body position or an absolute angular motion. So I just used 2 terms there, relative and absolute motions. Relative and absolute angular motions are both considered angular motion, and angles describe the orientation of 2 lines. So if you take your arm as an example, you have this angle that's formed between your upper arm and your forearm. And an absolute angular position refers to the orientation of an object relative to a fixed reference line or a plane, such as a horizontal or vertical line. So if you take your arm again, the absolute angle of the forearm could be described in reference to this sort of imaginary horizontal line. Now, on the other hand, relative angular position refers to the orientation of an object relative to a non-fixed reference line or a plane. So again, if you take your arm, the relative angle is formed between your upper arm and your forearm. Okay, so next there are 2 sort of pure forms of motion, which are known as linear and angular motions. And most human movements are sort of this combination of linear and angular motion, which is referred to as a general motion. So first, linear motion is defined as a uniform motion of the system of interest, so say the human body, where all the moving parts are moving in the same direction and at the same speed. So this is also known as translatory motion or translation. So for example, if you have someone just sleeping in a car that's driving straight on the highway, that is translating on the road. It's translation or a uniform linear motion. And you can also think of linear motion as a motion along a line. So if the line is straight, then you have what's called rectilinear motion. So a motorcyclist that's just maintaining this motionless posture as the bike moves along a straight path, that motorcyclist is moving rectilinearly, right? Straight path, rectilinear. On the other hand, if that line is curved, then the motion is curvilinear. So if that same motorcyclist decides to jump the bike and the frame of the bike doesn't rotate, then both the rider and the bike are moving curvilinearly through the air. Okay, next we have angular motion, which is rotation around this central imaginary line that's known as the axis of rotation. So this axis is oriented perpendicular to the plane in which that rotation is occurring. And almost all human movements involve rotation of a body segment around an imaginary axis of rotation that passes right through the center of the joint to which that segment attaches. And when angular motion or rotation occurs, then portions of the body in motion are constantly moving relative to other portions of the body. Now, in order to communicate specific information about human movement, we need specialized terminology that precisely identifies these different body positions and directions. And the anatomical position is really the starting position or the reference point for all of these movements. So in the anatomical position, which is shown here on the right, the body is erect as you're standing up tall with your feet slightly apart, and the palms are facing forward with your thumbs pointing out. So this position sort of resembles somebody that's just standing at attention. And that is the anatomical position, the starting point for whenever we're describing motion. Okay, so we also have to cover planes and axes of motion. And there are 3 planes of human motion and 3 axes about which the motions occur. So the planes are these sort of 2-dimensional surfaces, and the axes are perpendicular to the planes. And the planes are useful in describing the relative movements of the body parts, and the axes are used to describe the lines around which these motions occur. So I'm going to break that up now into each plane and each axis so that you can have a really visual understanding of what this all means. So the first plane we have is the sagittal plane. And this plane divides the body into right and left sides. Now, if that sagittal plane is placed directly in the center of the body, like it is here, then it's called the mid-sagittal plane. Any motion that primarily occurs in this anterior-posterior direction occurs in the sagittal plane. So motion like walking, squatting, lunging, running, that's all happening in this sagittal plane. Next, we have the frontal plane, which is also called the coronal plane. It divides the body into front and back sides, so anterior and posterior sides, and any kind of lateral motion would occur in this plane. So something like a jumping jack or a cartwheel, that would occur in the frontal plane. And the last plane we have to cover is the transverse plane, also known as the horizontal plane. So it divides the body into top and bottom halves, or superior and inferior. And in this plane, you'll see any sort of horizontal or twisting motion. So something like spinning or a figure skating twirl, that's happening in this transverse plane. Okay, so like I mentioned before, axes are what the motion occurs about. So a motion will be occurring in a certain plane about a certain axis, and that axis is always perpendicular to the plane. So first we have the antero-posterior axis, or the sagittal or cartwheel axis. It's this imaginary line that runs from the front to the back of the person. So it's perpendicular to the frontal plane, which we saw divides the body into front and back sides. Next, we have the longitudinal axis. It's also called the vertical or the twist axis, which makes sense because it's this imaginary line that runs vertically through the body. So this axis is perpendicular to the transverse plane. So any motion occurring about this longitudinal axis would be something like a spin or a twirl. And then the last axis is the transverse axis, which is also called lateral, frontal, mediolateral, somersault. It has a lot of names, but it's comprised of this imaginary line that runs horizontally from left to right through the body. And this axis is perpendicular to the sagittal plane. Okay, so that's it for planes and axes. On these next slides, I have examples. And my goal is to encourage you to pause the video on each of these slides and think and actually write down what you think the plane and the axis is for each of these motions. And of course, I'm going to give you the answer, but it's really crucial that you understand and that you're able to solve these sort of problems. So in this case, we have a cartwheel. What do you think is the plane of motion, and about which axis is this motion occurring? So feel free to pause the video, write down your answer, and okay, so this is the cartwheel happening in the frontal plane about the sagittal or anterior-posterior axis. What about this picture or this motion? Somebody running. what is the plane of motion and about what axis is it occurring? So this motion is occurring in the sagittal plane, and it's occurring about the mediolateral, transverse, frontal, lateral, all sorts of names. But yes, it's occurring about that transverse axis. Okay, so running happens in the sagittal plane about the transverse axis. And I have one more example for you. What plane of action is a spin in figure skating? Imagine her just sort of twirling around. And about what axis? So it's happening in the transverse or horizontal plane, and the motion is happening about the longitudinal or the vertical axis. Okay, so I hope those examples went well for you, and I hope that you did take the time to try to write down what you think the correct answers are. So just to recap what we learned in this lecture video, we learned about the different forms of motion, what the anatomical position is and what that means, and then the various planes and axes of motion. And in the next video, we'll learn about orientation and directional terms, some of which I sort of mentioned in this video, but we'll actually go into defining them in the next video. And then we'll talk about joint movements and finish with reference systems.